Biomechanics, you can say it's biology and mechanics. Biology is proprioception, pain, stretch, reflexes, healing processes. And mechanics is movements, force, elasticity, shock absorption, mechanical advantage, strength and coordination. Right? So since we deal with lots of mechanical components in pathology, the biology will have to be assisted by mechanics, which is physiotherapy. Fine. Okay, we can just. This is what Dr. Mamtara spoke. It's not suppressive, but synergistic to homeopathic treatment. Fine. See, in physiotherapy, there are two aspects mainly: the electrotherapy, we can say, and the exercise therapy. Electrotherapy will consist of all these electrical modalities which you must have heard, like shortwave diathermy, infrared sometimes, wax bath, ultrasound. All those is electro part. And the exercise therapy mainly is about stretching, strengthening, posture, all this exercise therapy. Right? Now this is about the shortwave diathermy machine, and it's moved in the circulatory form. It's held in the contact with the tissues. Right? Usually it's given for 10 minutes, and as I told you, it's for 10 days. What we use here is regular aquasonic gel. It doesn't have any medicine inside. It's just for conduction of the waves. These ultrasound waves are the same what which are used in the ultrasonography. The same kind of waves used here for therapeutic purpose. So basically there are no contraindications, except for that the area should be clear. I mean, there should not be any laceration, no cut like that. Apart from in the injury, it can also be used to break the adhesions. Because of, as I told you, it gives the micro massage effect. So because of that effect, the deep seated adhesions are broken out. Right? So this is ultrasound machine. Fine. Now this is in between it. We have recorded about the exercise part of exercise therapy I am discussing. This is a very new concept called as McKenzie concept for pain relief, if you have heard of. It aims at correcting the posture and achieving the full range of motion at the joints, and hence get the pain relief. Right? Fine. We'll come to it later. Right now, let's see. Right now what she is fixing is IFT. It's called IFT, which is interferential current therapy. Right? It has got these electrodes, which we fix again with the tape, and again the passing medium is, as I told you, it's aquasonic gel, and it gives a very high frequency stimulations. And because of that, there is a palliative effect on the nerves. This is especially useful in the cases like RSD, reflex sympathetic dystrophy, if you have heard of. It basically stimulates your nerve endings and it breaks the pain cycle. Right? So this here you can see she is applying this, and after IFT, usually the pain relief lasts for good 4-5 hours. It's so effective. All the patients who are admitted here, at our hospital with the sleepless problem, we give them IFT. Because it really produces very good analgesic. It's not analgesic, but it soothes the nerves, you can say, and for at least 4-5 hours patient is pain free. Right? But only thing what we have to be careful about here is that we should not do lot many things because you don't have pain. Like when the patient is put on bed rest, there is a definite mechanical component inside. The disc is already out. Though there is pain relief, it doesn't mean that he is cured. So we really have to make it very clear to the patient that this will give you pain relief, but it's not healing. It's just the pain. It's like a local painkiller, right? Again, it's computerized, and we have all set for different settings for myalgia, for tendinitis, for arthritis, everything. Like this is receiving ultrasound, Dr. Mamtara. This is the short wave diathermy what I was talking about. You can see these two pads, and here is the machine. The patient is supposed to, the area to be treated is, either we can keep it parallel like this, or we can keep it across the area to be treated. When you keep it across, the whole area is kind of treated. As I told you, the deep tissues, right at the joint level, there is increased circulation, right? So this is how the patient lies down with the diathermy. The contraindication for diathermy will be like a patient with very severe diabetes. In that we should have because usually the microcirculation is affected in diabetes. So we have to give it, even if we give, we have to give it with lots of caution. It may sometimes give burns. If the patient is patient doesn't report the heating, then they may end up with burns. Yeah, this is again the pendular exercises given for frozen shoulders, right? There is a pulley system it's basically called active assisted mode of exercising. These are therabands which are used for resistive exercises. This red thing what you see, this is the rope and the grill system which we use for different kind of stretches. Again it will be explained here afterwards. Sorry for this clip which has come ulta. Yeah. So she is demonstrating how we use TheraBand for exercises. For all the resistive exercises it's used. It's much better than the usual old thing of sandbag, which you must have heard before. The patient put the sandbag and is doing the exercises. In that the resistance is given in not a very even form. Whereas TheraBand gives you a very smooth resistance throughout the range of motion. And they are available in different strengths. Right from from yellow to the black. Yellow is the minimum strength, then goes red, then blue, then black, like that. This is as I told you, we use this rope and grill system to get different kind of stretches. Now when you think of the patient having this kind of posture, right, only exercising like this will not get him out of the posture. There has to be a sustained stretch, right? And when the patient does exercise by himself, the patient has got this, you tell him, okay, do like this, do. How much will the patient do it? And even doing like this for a few seconds will not remove those adhesions at the capsular level, at the joint level, at the muscle level. So this kind of, how it was shown is, we tie the belt and the patient is held in this posture for at least 5 minutes. The patient is staying there. So this sustained stretch which is achieved gives you the effect at the joint and the tissue level. It actually opens up your tissues. And then slowly when it's done daily, then they get the correction of posture. These are different equipments what we use for balance. This is a wedge, this is a regular Dunlop, right? The patient is supposed to stand on that and do a marching kind of thing, or a few proprioceptive exercises which stimulates the proprioception, right? This is a balance board. Again, all these are very useful after ankle sprain, or nowadays we say even in the osteoarthritis, right? The first, when we say there is a quadriceps degeneration, usually that's because your pyramidal tracts and your proprioceptive channel is degenerating, and because of that, it reflects on the muscle. And then muscle is showing, they say that vastus medialis is the first one to degenerate, and that's why we give them this terminal extension as exercise, right? So the reason for that to start is the degeneration at your nervous level. So that's how proprioceptive exercise, if they are given early in the case, then you can always delay this process of degeneration. It's going to happen, but we can always delay it. This is the way the patients are trained for balance. This is again for calf stretching. There is a kind of block